Let me know a little bit more about some of those moments in the chapter, in your engagement with Lacan, in thinking about decolonial interventions, politics, where questions of technique have been useful. You've said something already about interpretation. We've said a little bit about transference. But I suppose what I'm kind of also thinking about, and your previous response prompted this in some ways, is what about punctuation, scansion, or anything generally? It's just, and of course, the reason I'm asking is that you are so attuned to, as a clinician, these questions, and use very strong, very powerful examples of that. But in short, what else do we need to know about what might be useful modes of intervention, modes of technique that have been inspired by some of your engagement with Lacanian psychoanalysis?
Yeah. So, I mean, to sort of start the process of kind of tying some of these things together, if you have a model of the mind that is, again, continually trying to manage its level of affective arousal, and that it sometimes creates these very rigid bindings in order to protect itself, but perhaps at a certain point becomes counterproductive and gets in the way of that person's capacity to live, to enjoy, to work, and to play. And if that mind is further embedded in a linguistic network of associations about who's bad and who's good, who belongs and who doesn't, etc., then it starts to stand to reason that, again, paying very close and intimate attention to what people say, how they say it, what kind of words they use to express themselves, and then, among many things, reflecting back key words and phrases, or maybe even taking certain words or phrases out of context and kind of remixing them, giving them back to the patient in a new way, then focusing on those words should then trigger other associations within that broader network. And that broader network is going to be certainly relational in orientation, but it's also going to be embedded within a broader network of social, cultural, and political associations. Lacan at one point says, he talks about the importance on attending to the power of symbols in speech and trying to draw those out by what he calls punctuation. And I sort of play with it a little bit by saying, well, maybe we also need to attune to the symbols of power and positionality in people's speech. A very concrete example would be you're working with a patient who feels very kind of empty, devoid of meaning in their life, and they suddenly say to you, it's like I work so hard, but I don't know, it's like I'm not where I should be. Something very simple. I am not where I should be. If you listen closely to the structure of that phrase, it winds up kind of signifying a number of different things. Among them, the idea that the patient is somewhere here and that they're not where they should be, which might be somewhere here. If you're seeing this on YouTube, you see my hands creating this little hierarchy here, right? I'm in this lower position instead of being in this higher position, which is where I should be. If one simply reflects back those words or remixes them in some way, something as simple as where you should be, or framing it as a question, where you should be, right? All of this is given back to the patient in the hopes that it's going to trigger other associations that eventually, and I would certainly say this is so in my clinical practice, lead to questions of class, leads to question of gender, lead to question often even of race and racial positionality, even sexuality, right? So when you attend to language that kind of implies a certain verticality of experience, it often winds up being a royal road to the social unconscious. So in very short order with this patient, it might lead to questions if they're a cis heterosexual male patient. It might lead to questions of how they feel about their masculinity. It may lead to questions about their class position. They're not making as much money as they're told that they should be producing in order to be a provider, to be a good man. Or maybe also to be a good man as a Latino man, right? So suddenly all these different significations around culture and identity start to spring up quite organically in a way that can allow us to do any number of types of work, depending on what kind of theoretical frame we're most attuned to. right? So if you're more Lacanian, you'll certainly be more attuned to the ways in which these things play out in speech and language, evoking them in order to get the patient to articulate them and then get some critical distance from them. Where Lacan describes it in this way in one of his later seminars. They are trying to get patients to have a certain kind of, we might borrow the term extimacy in relation to their own speech, that they're able to identify with it, they're able to see it, but they're also have some critical distance from it and wonder, like, who is speaking when I say these words? Does it come from my parents and their history of immigration? Does it come from broader cultural discourses about what a man should be, what a Latino man should be, et cetera, et cetera? If you're more relational, you might wonder about, well, how is this playing out in our therapeutic relationship? Are they alluding to ways in which I've made them feel, say, less masculine? Because they're working with a clinician who is a doctoral level psychologist. They might have all sort of fantasies about my class position, right? How is that playing out in the transference countertransference dance? How is that playing out in relation to their own unconscious, broader social discourses, et cetera? It's a very, actually surprisingly simple and straightforward technique. It's just playing with words, treating the patient's speech as a text to be edited, to move literal periods, to move commas, right? All that sort of stuff wound up being incredibly useful to me, in part because, again, it's not something that you really talk about in relational modes of training and supervision, right? So just reading about Lacan and reading about the ways that Fanon sort of plays with Lacan got me to thinking a lot more, not just in terms of, do I give the patient space or do I bring it up? But how can I sort of play with the words that are already in the room in a way that makes these things present and alive in a way that can be worked with? So not having abstract intellectual conversations about race, gender, sexuality, and class, but addressing them as lived experiences in the room.
So you cited a line from Lacan there, and in one of the pieces of your text that I pulled out for the interview, I've got that quote. So I'm just going to back to you, because what I think you've done marvelously there is to be able to point to a point of inspiration in terms of technical inspiration, as it emerges in a kind of Lacanian approach, but articulated in terms of exactly how it could be utilized in a kind of Fanonian clinic. So here's the quote. If the analyst's role for Lacan is to, here's the direct quote, play on the power of symbols by evoking them in a calculated fashion in the semantic resonances of their remarks, end quote, then a Fanonian lens reimagines that analytic function to play on the symbols of power, identity, and culture that emerge organically in the analysand's speech. So what you just said, that's the quote. So what you just said was really tremendously helpful, both in showing a kind of overlap in terms of technique, but also how one might apply that technique to hear more of a sociogeny, I suppose. Yeah. And I suppose why I find that so helpful was, now that I reflect on it, one of my kind of questions that keeps on coming back in the course of this interview is, does Lacan have enough of a sociogeny in terms of what Fanon may have wanted? And we don't have to answer the question. Maybe it's nice to keep the question there as a kind of tension, or as a kind of goal for thinking about practice. But one slightly, minor little thought that I had was, one of my kind of moments of a Lacanian training was this constant interest of supervisors in grandparents, great-grandparents, like history, and I'm not saying other forms of psychoanalysis don't do that, but like a real focus on a whole symbolic, and I suppose by default also cultural lineage that comes behind someone that is being replayed out in various facets of their life in some way. Yeah. So I wondered if you had any comments or thoughts on that as well.
Well, how do I put this? Like, you'll find Fanon being more critical of Adler than he is of Lacan, or more critical of Jung than he is of Lacan. And I think that's because Lacan's model opens things up from jump in a way that's more useful to a decolonial approach, precisely for those reasons. It's an approach that is readily it's sort of cooked in the broth of the model to be non-dyadic by definition. So it allows room for thinking about intergenerational transmissions of trauma in a more readily accessible way than in some relational models. Like you'll have relational models that'll talk about intergenerational transmission of trauma, but it's almost like a series of dyads, one transmitting a dyadic mode of relatedness to the other, which doesn't quite allow room for the broader historical context, right, that those grandparents may have gone through. So it's a little embarrassing at times, once I, kind of read as much of the record as I could muster, to feel that, wow, I don't have a lot critical to say about Lacan, actually. I'm obviously going to do certain things very differently from average Lacanian practitioners. It also relates to a thought I often have, which is that, you'll hear people say, well, Marx didn't talk about the global South, or Lacan didn't talk about the global South. But then if you actually read Marx and Lacan, turns out they did. Like it wasn't clearly as central to their theoretical model as other things, but the material is there. Like I would say there's material to work from and build on, as opposed to there being nothing at all, right? And I think that's the critique I have of certain critiques of certain writers like Lacan and Marx, where there's this idea that there is nothing there for us who are from the global South. And yet I have to account for the fact that, once again, that many of his analysands were from the global South. He was directly engaging with many anti-colonial thinkers and theorists. And he has these moments in the seminars and in his writings where he directly addresses questions of colonialism, capitalism, and so forth. He doesn't center it in his work in the way that Fanon does, but there's a kind of platform from which to work from, to build on top of that work.
So here's one. If we can imagine this triangle between Tosquel, one point, Fanon, another point, Lacan, another point. In this triangle, we can imagine various innovations of technique and practice. If you had to do this kind of little triangulation exercise now in terms of what overlaps, what intersections, what conjunctions you found personally clinically useful that may draw on in alternative capacities the work of these three clinicians, what comes to mind?
Well, what comes to mind is the discordances between theory or explicit theory and technique, right? Like there are certain things that Lacan said explicitly he would do, and certain things we would imagine he would say he would not do. But then in his actual clinical cases, and again, these first-person accounts of his clinical work, what he said doesn't necessarily match up with what he did. And so we have to kind of choose, certainly among the three theorists that you mentioned, do we only take these clinicians at their word, or do we also integrate other things that they did that may perhaps even rupture the model, but were nonetheless analytically effective? So the Tosquels, again, integrated Lacan and Ferenczi, as did Fanon integrate Lacan and Ferenczi. He integrated certainly Lacan's emphasis on speech, certainly the way in which speech is contextualized in a broader social political world. But at the same time, Fanon also drew in a lot of Ferenczian ideas around rupture and repair, the therapeutic relationship, enactments, and so forth. There's also ways in which Fanon, because he drew on Ferenczi and Ferenczi's active therapy, much like the Tosquel, he also does a lot of things that today we would consider cognitive behavioral and orientation. So things like exposure therapy, behavioral activation, having patients engage not just within the bounds of the session, but also engage in therapeutic activity in the world. Again, through the same model of facing things that were originally scary or anxiety provoking, but with a new outcome. So it's the exact same theoretical logic. You might say, well, Lacan would never do that. Well, Lacan did this little thing you alluded to earlier, which is scansion, which is cutting the session short, right? Well, what is Lacan doing there? Well, if we remember what Lacan writes about the technique, he says, you know, there are times where I sit with patients and they're just telling me all about their thoughts on Dostoevsky. And then I took this one patient and I just started ending the session early. And in the time where I would have still been listening to his masturbatory intellectualized discussion of Dostoevsky, he's telling me about these fantasies of giving birth, right? In that same section where I talk about Scansion, I also cite again one of Lacan's patients who says, well, when you don't have time to think, because the session could end at any moment, you have to say everything that comes to mind, right? But there's another element to Scansion that was very important for Lacan, which is that you're not only, it's not just that you're cutting off the session when the patient says something evocative. You're sort of leaving them with it to chew on it, but chew on it in the context of their life, right? So they're taken out of the relatively safe context of the session, and they have to face their life anew. By the definition of what Ferenczi and Fanon's active therapy is attempting to do, and Fanon says this quite clearly, action upon reality is integrating. What's Lacan doing if not getting the patient out of the session and back into their life, where they have to wrestle, not just with what they said evocatively about their life, but that they have to face their life as such. In that respect, Scansion is an active intervention. It can't be seen in any other way. You make choices as an analyst, not just in terms of what words you punctuate, what phrases, but also at what point you end the session, which necessarily brings the patient face to face with their world. Another reason why that's important for Lacan is that within his model, certainly us relational people would disagree, but for the sake of the argument, he's trying to prevent a certain kind of dependence on the analytic relationship, to make of the analytic relationship a safe pocket universe separate from the world, as opposed to continually engaging the patient to face that world directly. So there, I wind up making, again, an integration along the same lines. Not only is it important for the patient to face these, let's call them bit of real, in the analytic relationship, they must also face them in the context of their life in order for analytic work to be effective.